chronic pain and your nervous system. In this session, we're going to be looking at the complex issue of different types of chronic pain and at how it can impact your nervous system, and your nervous system can actually impact your level of pain. We're also going to be talking about a bit about brain smudging and sensory and motor issues that can happen when people have long-term pain, chronic pain, and some of the complexities that happen, and why chronic pain is very common in a lot of empath sensors and those with sensory processing issues and so sensory processing disorders. So what is chronic pain? So there is different types of pain, first of all. So if we look at, for example, muscle pain, a lot of us can identify when we've experienced muscle pain, and you can experience, all sorts of muscle pain in all sorts of areas of your body, such as your neck, your shoulders, your back, your hips, your arms, your legs, your feet, even your calves. And there's all different types of muscle pain. So you can have muscle tension, which causes muscle pain. You can also have things like a torn muscle, a torn ligament. All these things can cause problems and strain and things like that. But we also have inflammatory pain, and inflammatory pain, includes things like arthritis, sometimes infection or tissue injury. It can also, if we have high levels of stress, that can actually trigger an increased inflammatory response, or actually cause the inflammatory response. Things like a lot of toxins can actually create a lot of inflammation. Things like a poor diet where you're not getting certain, vitamins and minerals. The body is not getting nourished enough. And when someone has malabsorption issues where they maybe leaky gut and things, and they can't absorb their food correctly, and again are not getting the nutrients they need for the body to repair itself and for the body to actually get rid of toxins, naturally detoxify itself. Now, another common cause of pain is mechanical and compressive pain. And we see this in, spinal cord compressions. We see it in spinal disc degeneration, excuse me for the spelling, the wrong spelling for disc. But we also have, things when you've had a traumatic fall, even a tumour, and also things like being in some sort of accident. Think about car accidents, and even sometimes just a little bump can actually put the spine out of alignment. And poor posture is a huge, can cause huge issues in relation to mechanical and compressive pain. So when we think about posture, that can be a long-term thing. And sometimes the reason we get into poor posture is actually because of an injury, because of a previous fall. And if you think about even from a young age, we can have all sorts of things that sometimes weren't addressed properly or dealt with, and that can cause us common problems later on. Now, another type of pain is nerve pain and neuropathic pain. And nerve pain can be caused by things like sciatica, diabetes, bacteria. So if you think about even when you have nerve problems with a tooth, right? Viruses, so things like and bacteria. If you think about Lyme, anyone that gets Lyme disease where it's a co-infection and it hasn't been treated, so late stage Lyme, that can really impact the nerves, and the bacteria actually kind of attacks the nerves and causes a lot of inflammation, and the longer it goes untreated, the more challenging it can be. But also things like mold and things can contribute to these things. And we also see neurotoxins in relation to heavy metal toxicity, which again can create all sorts of problems. And we see this also in vitamin deficiency, where again, for example, some of the B's, vitamin B deficiencies, can cause also problems with the nerves, and you know the nerves are maybe not repairing themselves. And if we think about even the myelin sheath around the nerves and things like that, that can be compromised for a variety of reasons. Now, if you look at chronic pain, different parts of the brain, such as the nervous system, can really become activated when pain becomes chronic, right? So there can also be what we call brain smudging of the sensory and motor homunculus. Some of these challenges are far more common in highly sensitive people, empaths, those with sensory processing disorders, and certain health challenges. And you'll learn more as we go through this, and we kind of understand how the nervous system works and why certain people are more likely to have these challenges, but also not just have these challenges. Sometimes, why is it more complex to reverse these in some types of clients or patients? So if we look at nervous system dysregulation, right? So when someone has long-term pain, and there's different reasons why we can have long-term pain, but it can increase and cause a heightened sensitivity to pain. So you have central and peripheral sensitization, and normal sensations like touch or slight pressure may begin to feel painful. So if we think about some of all the reasons that we've talked about, all different causes of pain, and the more that someone maybe has something that hasn't been addressed, right, that can lead to all sorts of stress on the nervous system, which causes that dysregulation. But also there can be certain circumstances when someone has maybe had a traumatic fall or traumatic injury, and for some reason the body thinks it's like it goes into what we call a faulty kind of electric system, and the body thinks it's still got that injury, right? And it's still not resolved, where sometimes it's healed. And sometimes it can be a combination of things, that someone can have something healed, but they can have another issue that's causing them, maybe because if we look at, for example, nerve damage, and we can look at compression injuries and things like that, there can be a combination of things, right? Now, when the pain amplifies over time, even without continued injury or damage, the volume of the pain is turned up and stays stuck there. So what that means is the nervous system is not maybe in harmony and balance, it's not working properly. And what happens is the pain becomes more stronger, even though the maybe injury or damage is still not present, or it's not any worse than what it was. And basically that level of pain starts to get worse, right? Now, basically the brain changes in this process. So when the brain, when we see people who have got pain that's not been treated, right? For example, this is, first, if we think about that first, right? What happens, that stress of that, and if they're under a lot of stress as well, because of the pain or out with the pain, the brain can start to create what we call maladaptive neuroplasticity. Now, we hear neuroplasticity begin bands about, and a lot of people talking about that, and that the brain's capable of changing, and of course, and it's able to rewire itself. But sometimes people don't understand what the maladaptive neuroplasticity is, and why in some cases it can be more complex than others, and it's not always a case of maybe one approach. So basically, the brain rewires itself in response to ongoing pain, which can create a pain memory that persists even when the original injury has healed. Now, if you think about the amygdala, which is where fear where fear resides, that part of the brain becomes very reactive. So you think about the survival response, the fight or flight response. And basically what happens there, it links pain with fear. So the body goes into this kind of trauma, right? And it links it with fear, anxiety, and trauma. And the part of the brain, the prefrontal cortex, that is a decision-making part of the brain, which helps us be more, in many ways, rational, focused, and more emotionally regulated. What happens? That starts to shrink and they start to have problems. So it's just not functioning the way that it should. And what happens also is pain pathways begin to strengthen. So instead of the natural pain inhibiting hormones and pathways, instead of them coming to support and to diminish and lower the pain, those things, the pathways become weaker. And so what happens is the pain becomes stronger rather than where, there's lots of things in the body that are basically like natural painkillers. It doesn't seem to do that anymore. Now, so basically what's happening is the dysregulation then of the autonomic nervous system. The brain is rewiring itself in response to that ongoing pain, which then creates a pain memory. That persists even when the original injury is healed, as I've explained. And this chronic pain can dysregulate the autonomic nervous system, which controls involuntary functions. And your involuntary functions can be things like your heart rate, digestion, and stress response, right? Now, our autonomic nervous system, we sometimes don't realize how many things rely on the autonomic nervous system. It's like something in the unconscious that we're doing. Sometimes it's reflexes and certain things, right? And that becomes dysregulated. So that then starts causing all sorts of challenges. And this then leads to further what we call sympathetic dominance. The fight or flight remains and becomes prominently activated. So that becomes kind of certain stage that the body is just in this state. Now, because of that, we have an increase in muscle tension. You get a lot more inflammation and you start producing more stress hormones like cortisol. But what can also happen is you can either start producing a lot of cortisol or you start not producing enough because, again, the body's dysregulated. Now, during this, the suppression of the parasympathetic. So the parasympathetic is the part of the body and the functions of the body and the systems of the body that move us into that rest and repair. And in relaxation therapy and stress management, we call it the relaxation response. And basically, when our autonomic nervous system is dysregulated, that our body is not able to get into that rest and repair, and it reduces the healing capacity. Now, then we look at the peripheral nervous system sensitization, basically with chronic nerve pain. Nerves in the body become really sensitive and sensitized. So basically what happens then, it sends stronger and more frequent pain signals. So everything becomes more alarming, more sensitive, and everything becomes more painful, right? And things can start to get a bit, almost you would think, a bit crazy with the nerves. So this can cause burning, tingling, or stabbing sensations, even in areas not previously affected, right? So this is where people they've maybe had an injury somewhere else, and then suddenly they get these really strange pains somewhere else. And that can be caused by damaged or inflamed nerves, which may start, it just fires all over the place. Now, I had a situation, I've just been very unfortunate that through my life from a baby, I was dropped downstairs. I had all sorts of things that happened that including medical harm. And one of the unfortunate things I had was a lot of injury from dentists, right? This included slightly putting my jaw out, having twice injections that damaged nerves, and it caused what they call trismus. And it basically locked jaw, where the jaw actually locked shut because of the damage the nerve had actually done. And in one of the cases, I ended up being left for about, I think it was I can't remember if it was 7 or 10 days I was left with a completely shut mouth. It was, at one point, I think it was about a couple of millimeters. I could just open my mouth and then it completely shut. And I ended up with sepsis. And they had to do, different things, and I had quite a bit of an infection. I was in intensive care and I was very, very ill. And when I came out, I had I had a lot of issues around the jaw area and down the right arm where the infection had seemed to kind of accumulate. And other than having a history, had different things happen. One situation that I should have addressed and I didn't address was a young boy, not, it probably was maybe less than a year before this incident, was that I actually had a young boy kicked me, and it was completely accident. I know it sounds a bit crazy, but the young boy was doing a somersault and trying to show off and knocked me flying, and I went flying across a room and crashed against a very really old stone wall, and I ended up underneath a table. And I remember there was a nurse at the time in the next room, and she said she could hear the crunch. And at the time, I didn't want to make a big deal. A lot of these kids were really upset. They were hysterical because of the impact I took. And I never, ever went and got an x-ray or anything. And I had some bruising in the chin, but I never really thought anything about it. But when, after the sepsis, I started having terrible, horrendous, and I mean horrendous pain in my right ear, it would actually knock me over. And I became so noise sensitive that the slightest certain pitches, for example, and certain noises, particularly in the right side in the right ear, and vibration, not just noise, but vibration, would knock me over and cause me horrendous pain. But I'd also this weakness, a lot of nerve pain and nerve problems, motor skill issues, which then went into a complex movement disorder. But I also had a history of being very unfortunate again, that also a dentist when I was only 19 put mercury up the actual root canal, not the where when they were supposed to clean out the root, he accidentally forgot what he was doing, and it was another dentist that informed me that had actually mercury put up the actual root canal, which is extremely dangerous. And I ended up with a lot of complications, and nobody took responsibility for it, but I always say a lot of my health challenges started that. And then also, it would take many years later for me to get a diagnosis that it would appear that other things, very rare things that I had, was actually late stage Lyme and what they call co-infection, particularly co-infections that cause a lot of extreme neurological challenges. So there was a lot went on. I had also a tailbone fall. I had lots of things. And I remember even when I was young, going to an osteopath, and he talked about the compression in the skull, compression in the spine, and all these things. And even though I went for a lot of help and I've spent most of my income over the last 30 years and more on my health and well-being. One of the challenges I had having so many complex issues that sometimes some of the treatments or some of the support ended up causing me more problems. But what happened to me about 18 months ago, and there's a reason why I'm explaining this, I had went to get some help. I had different things, went to a chiropractor, also had a body therapist friend doing some work on me. And this and a few other things seemed to create this problem where I ended up with, which I believe, a neck that was not really that stable, that had already issues, was this cervical kind of what you call instability, instability in the muscles and in the cervical area of the head. And I ended up with so many complications. And it was also someone at the time, I was also doing a course, which is a other story, that did things that were to do with kind of, you would call it maybe brain training and certain breathing techniques and certain things. And I went on this course and it actually made me extremely worse and caused some really serious problems. And this is where I think it's really important. This course that I went on to was actually aimed at more chronic pain, but it also approached what I'm going to be talking about in this, about brain smudging. But the problem was I had lots of complex issues, and the course was like one of these signature programs, which was, this step-by-step process, but it was not suitable for someone with me with a lot of complexities. And this is a huge problem in the health and wellness industry. It's also a huge problem in the healing and spiritual industry, where people are being taught and, being guided by many business and marketing coaches just to create signature programs to make their business easy and feasible. But what the problem is, often these are marketed to almost a wider audience, and they're not always suitable for every client. And I would urge you, if you are dealing with clients that have complex issues, that you try and maybe offer one-to-one support, and or are very clear with programs when they are not suitable. And also, one of the things that I've had to learn, even though I have a lot of friends that are in the healing and therapy industry, and there's some therapists I would trust with my life, but a lot of them have actually kind of leaving the industry. What I would say is a lot of the old school who really approach safe and effective practice and are really thorough. There's not as many people that have that approach now. A lot of people are just so focused on making money and don't always see the bigger picture. But believe me, when people have complex issues, you can really do a lot of harm. And what you can actually do is increase their pain. Because when you're trying to support someone through helping them towards healthy neuroplasticity, and even different forms of, there's so much out there that is designed to support people with somatic therapies and vagus nerve stimulation and all that. But a lot of it is not always safe for every client, and it's really, really important to remember this. And it's then with even treating chronic nerve pain. I've went on many detox programs over 30 years, and again, even when I didn't know I had Lyme's, I had been diagnosed as ME when I was younger, and I seem to have lots of infections and lots of strange things. But some of the detox programs I was on were actually quite dangerous as well. So it's really, really important that when you're getting help in any of these areas, and if you have some of these issues that are complex, that you go to someone that is really qualified in their field, and don't be shy about asking about their background and how much experience and insight that they have. So when someone has any of these situations that I've talked about, and maybe a combination, they're more likely to have what we call emotional and cognitive looping. Now, what that means is the pain can trap the nervous system into a feedback loop. So if we think about pain can be very stressful in the body. Stress causes anxiety and depression. It can lead to other types of mental health challenges, and increase this perception. There can be this worsened pain perception, and the brain can trick us, the body can trick us. Now, that doesn't mean that you're imagining it. You're not imagining it. It's very real, and the signals are triggering that level of pain. But that can obviously then, the more that the pain gets worse, guess what? Your stress levels get up, and it's a vicious cycle. So you have to be able to cut different things in the loop. And sometimes it's getting someone that will help you do it in the right way. Now, there is some basic things that we can all do to help and support ourselves. But also, what I see a lot of people putting out a lot of things out there, and it's not always based on complete truth, and it's sometimes described more simplistic than what it is for some clients. And that's why there's some people who will spend tens of thousands of pounds going to these top experts and even top healers in the world, and then they still can't get past, because again, they're not looking at the individual. Right? And it's really important that when we're treating chronic pain, that we treat it holistically. We look at the individual, and you look at yourself from an individual perspective, and do not be pushed into a treatment or therapy that does not feel right, that you know instinctively is not right for you. for whatever reason, because one of the things that, therapists are not all knowing. They don't know everything, just like doctors are not always all knowing. And of course, yeah, you've got to be sometimes open and be willing to learn. But I've learned a really hard lesson in situations where I've put who are supposed to be top experts in their field, and actually then they went and had to apologise after, went, oh, I never really thought about blah, blah, blah because of your circumstances, and I'm really sorry. And then it was been too late. And so this is really important. But there are some basics we will talk about that are really helpful for most people. But again, there is a lot of things being taught out there that are not always clear cut and the best option for some clients. So why is this loop especially strong in individuals that already have trauma, like post-traumatic stress disorder, or someone that already has sensory sensitivity or sensory processing challenges? So if we think about someone that's highly sensitive or empathic, and then you start getting into people that maybe are on the autistic spectrum where there's disorders and other sensory problems. Well, the reason is, first of all, if you think about anyone who's already has trauma, their nervous system is already very heightened. There's already a lot going on. It's already being compromised. And it's the same with, if you think about all the different types of pain. If someone has all these different types of pain, I was very unlucky. I had structural, I had nerve pain, I had also inflammation, I had all sorts of. So even though there was a lot of things I actually minimised to a minimum, the unfortunate thing, if certain things, another thing would happen, we all sometimes then have a fall or we knock something out. And one of the things that maybe I never thought to mention as well was, one of the things that I didn't really think about myself was, I was diagnosed as having a connective tissue disorder since a baby, but never really thought much about it. And then one of the things that I did learn in the course that I was on, that I was clearly had somebody that was hypermobile in my neck. So if you have hypermobility in certain joints, certain things can happen. And sometimes also, if you maybe go to a yoga class or a personal trainer that is maybe giving you techniques or things that are actually not suitable for, again, if you're hypermobile. And if you're hypermobile, you might be more prone to overstretching. I didn't know that I had been overstretching a leg for years that was causing more problems. So sometimes we don't have the full picture. But if someone already has trauma and has, a lot of emotional and stress, that's one thing. Then you start getting into, people with certain conditions, that's another thing. But if we think about the sensory system, if there's already some sort of oversensitivity, or it's just not working the way that it should be, well, guess what? It's going to be far more likely that person has far more challenges and everything's more heightened or more painful or more challenging. So it's really important to be aware of this. So chronic pain has a profound and often complex impact on the nervous system, affecting both the central nervous system and the peripheral nervous system. Nervous dysregulation, or what we call chronic nervous system dysregulation, can create all sorts of harm to the brain and the nervous system, such as brain smudging. And you could probably call it more to do with, when I'm talking about harm, what I'm talking about is the electric system just doesn't start to work. It's the electric system, it's like the signalling is not working. And then sometimes cognitive function can start declining, right? Now, so what is brain smudging, right? So brain smudging is basically a metaphor used to describe changes in the brain sensory map. So the brain normally has a precise map of your body that helps it localize sensations like touch or pain. So your brain would normally have this kind of almost like a map linking to where your smell, your sound, your taste, your feeling, all of those, right? But when pain persists, the brain's representation of that affected area can become blurred or smudged. So it gets confused, right? And it's like almost, so then that is where other things can happen. The pain can move, or other senses can start to struggle and not function properly. So this can lead to pain spreading to nearby regions, or difficulty identifying where pain is coming from. But it can also cause all sorts of challenges that the brain gets a bit confused and it's struggling in one area. Now, if you think about someone that already has an area that's not as never functioned as well as other people, then they're more likely to have brain smudging and other problems. So, for example, one of the things that I, from a young age, started to lose most of my sight in my left eye. I can see almost, if they use certain things on my eye, I can see a bit of colour, but I can't really see out the eyes. I can't really use that eye in general things to read and things like that. So there's always been a compromise there at something, and also I have a problem with dilation. There's a problem which means that the eye struggles to rule. It's very, very slow to dilate and to move and to rule out light, which can impact the back of the eye. Now, that's just me, that's one example. But if someone has, like, for example, one of the senses just is not functioning, or they have a hearing problem, right? And then the 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 chronic pain becomes a problem and the brain starts smudging in one area, you can imagine it starts to create more problems. And brain smudging can then lead to all sorts of things. And when we have this challenge with the brain is feeling stressed out and it's feeling overwhelmed because things are too much, what happens, certain areas get smudged and are not working the right way. And what brain smudging and this type of thing can create in these kind of issues can create all sorts of problems with the person's ability to feel. So they can maybe have problems not feeling certain areas of the body. I know for me, I had a lot of no feeling in the back, right side of my buttocks and certain parts of my legs. And also they can have problems, their coordination, their movement, and develop things like movement disorders where the body is moving in ways it really shouldn't, and it can start creating all sorts of problems. And I ended up with all sorts of problems. And this is where, when something isn't addressed, now I had a big, huge problem with different injuries that I had, doctors not listening to me, not believing me, huge problem with a lot of women. It's, a big, big thing. And I particularly think if you're very sensitive and tend to be quiet, you don't like to cause a lot of stress, to doctors. You don't make a big deal of anything. Even though I would stand up for myself with a lot of health things I had to, there was so many challenges that sometimes I felt I couldn't fight every battle. And one of the challenges is that, unfortunately, a lot of mainstream medical system, they are not interested in finding the cause, looking at the root cause, and always looking at the bigger picture. So many people go through large parts of their life with postural issues, with all sorts of pain that's not been addressed and not helped in the right way, or that again they're just coping, and that the level of, they start getting into this emotional and mental aspect of pain. So what is the kind of normal treatments for chronic pain? Well, one of the things I would say right away is, with any type of treatment for chronic pain, if you want to get to the root of the problem, and you want to not just become reliant on prescription drugs and go down that way, right, is you want to look at a holistic approach to treating the cause of pain. I was diagnosed quite young with fibromyalgia, and I kept that under wrap. I got to a stage where I could keep most of that at a minimum, right? And one of that was by a completely holistic approach, using things like having a clean diet, using a lot of what you would call water therapy. I would have baths and use things like Epsom salts and things to make sure I was detoxing. But I would say, I have to be honest, sometimes really damp weather and it's certain things would trigger it. And that seemed to be also related to, which I discovered just to do with different things, that can be related to mold, bacteria and things like Lyme. Okay. Now, Another thing that's not talked about, but I think I have to stress, and I've been reminded this in so many levels, is that it's really, really important to help clients to feel grounded and safe in their body. When people have pain, they just want to escape the body, and it's again a catch-22. When people don't want to be in their body, don't want to feel the pain, energetically they move out of their body, and that creates more imbalances in the body energetically, even as a healer. If you're a healer, what I'm talking about is an energetic healer, a spiritual healer. When you look at from energetic perspective, the person's not fully in their body, in their energetic field, and they're away out, and their body wants to escape. Very, very hard for the body to heal. The body has to be fully in the body, right? And part of that is how the therapist approaches the client, and what they do to make sure that the client feels mentally, emotionally, physically, and psychologically safe. And that can be all sorts of other things going on underneath that can impact how a client feels safe or not. Now, you want to obviously do what you can to help the nervous system to regulate. And of course, if you depends on what modality and what the problem is. There is sometimes chronic pain that is just an emotional issue. Something's trapped, and there's other major things going on. There's all sorts of things, and you want to try and do that. But in that process and through that, you want to keep doing what you can to support the nervous system. I prefer teaching things like relaxation therapy and things that are more safe and effective. One of the things you see a lot of breathing techniques, and I'm not saying breathing techniques can be helpful, but one of the biggest, and it's a bit of a bugbearer for me, is so many people teaching breathwork techniques to everybody and anyone. And a lot of these techniques not always suitable for everyone, not always safe and effective for so many reasons, particularly if people have structural issues. So think about the compression, right? Sometimes people who have muscle issues, when there's muscle weakness, right? If people have connective tissue disorders or other disorders, even like chronic fatigue and things, some people can actually end up having problems with their muscular system. If you think about things like even hernias and hiatus hernias, these also can be trapped, the way that the muscles they're not working properly, and they can sit not in alignment. And then if certain breathing techniques are used, they can actually be very painful and cause the patient to even have a further stress response and can really impact the nervous system. And we've got to understand that the nervous system is linked to things like obviously the vagus nerve. It's linked to, the spinal cord. There's links to sometimes your cervical nerves and all that can trigger things. There's a lot of things involved. So when people have nerve damage and other things depending on it, you want to be using techniques that are relaxing, safe and effective. And there is a lot of breathing techniques that can be really quite stressful on the body. And if someone's not physically fit enough, that again can cause problems. What I would say is, if you're considering doing training in breathing techniques, please don't do courses that are only a couple of days old. Do things that are thorough and make sure that the training covers a lot of contraindications. You often can tell what's a really good course when they are not frightened to go into the contraindications. When they're not frightened to go into the contraindications, that gives you usually a good sign that they are more about safe and effective practice, right? And they get you to think out the box. Now, obviously there's some somatic therapy and things like that. Again, it depends on, there is some techniques and how they're done, when they're done. And it's not just about how, in what order, and there's a whole new thing. I go into some of this, and I no longer offer the relaxation training that I used to do, but I do have packaged it up into over 20 plus relaxation therapy tools and techniques that I used to teach my relaxation students. And it goes into all the safe and effective practices and what techniques you should use and when, and some of the more safer practices and some of the things that you should consider with different types of clients. So I will put a link to that below. But when you're also using safe and effective approach to neuroplasticity, there's so many things, if we look at even things like hypnotherapy, using the right words for that client, making sure that you're not re-traumatizing them, making sure that you're approaching the way in neuroplasticity, you're considering lots of things about that client, and again, you're looking at it. So it's important that you're doing things that are not going to make them feel under. You're not gaslighting them, and you're not making them stressful. There's lots of techniques out there that are being taught that are actually gaslighting the clients. And there's lots of approaches. Like one of the things, and it can be very useful for lots of people, EFT, but a lot of people with sensory processing challenges and people who've got nerve pain can find things like EFT very uncomfortable. And actually, just the fact it's tapping on the body actually can create more brain smudging because that person can't handle that. And it's just like if you look at people on the autistic spectrum, but very few people are taught this, and they don't have enough training in the anatomy or enough training about how the brain works and these kind of things. So it's really important that you consider different things. Now, obviously, you want to reduce inflammation of the peripheral nervous system, and clean diet, as I said, trying to address maybe things that are going on, like viral and bacterial things that have been, things like sugar. Sugar is one of the biggest things that increases inflammation, right? But again, sometimes people are exposed to mold and damp and things like that. So there's different things. And as I said, the stress and thing, that's obviously has to be addressed. And you also want to do what you can to reduce emotional cognitive looping. Now that is, looking at things and not getting into catastrophizing about your pain or catastrophizing what's going on, which is not always easy because sometimes I know what it's been like. One of the things that I had a problem was some specialists said to me not to wear earplugs, and other kind of people said, well, maybe you should because you definitely can't function, right? So what I did was I avoided using earplugs most times and earphones and things in the house and things like that until certain situations people were very loud or I was in company. Right now, I learned the hard way that when I completely didn't use it, I was actually, it was getting worse. My levels were getting worse, and I had to learn to balance it. And I tried using also soft sounds to change things. Some of it didn't really work for me, but we have to, we all have to approach things a different way. And you want to obviously do things for your mental, emotional way and help the client mentally and emotionally as possible. And sometimes we all need help because we have blind spots. So it's really important to do that. But again, watch, because there is again a lot of people that dismiss a lot of people with extreme challenges and are coming not from a place of compassion, but very much ego, and they can create more harm than good. Now, if you have, if you're looking for some just even tools and techniques to just help relieve some of your chronic pain, particularly if it's not too complex, I have a little course. I would also recommend that you check out my free grounding tips, because grounding is one of the most basics when we have chronic pain. And I think you might be surprised some of the things that can help when you feel more grounded, because it's easier to relax. And if you are highly empathic and highly sensitive, check out the Empaths Essential Toolkit, because one of the biggest challenges and one of the biggest reasons that empaths and sensitives have the chronic pain is not just to do with all these issues. It's because they've already got very poor boundaries. They're not energetically they're not protecting their energy enough. They're not doing things to regulate their nervous system as much. And there's lots of things that you'll find really, really helpful in the Empaths Toolkit. I hope you've enjoyed this video. Please like, subscribe if you have. And if there's any aha moments through this video, anything you would like to share that you found helpful or you want to ask, put it in the comment section. Have a wonderful day, and as I said, check out the content. I have lots of free resources and free courses that you can sign up. So make sure you check out the channel and check out the links in the description. Bye-bye.